Hey y'all, I'm Willow, and this is the Fed Up Unicorn. There has been a lot of misinformation going around about gender-affirming care, so today we're going to discuss what it actually is. I was working on this for a while in between other things, but recent moves here in the US has made me want to concentrate on this one. And for the same reason, there will be more of a focus on minors throughout. I will provide sources in the description so you guys can look at it too. For most, I do believe they care about the children, but are misinformed on the process and the possible regrets. If you are a parent of a trans child, please take them to a trans-friendly doctor at the very least. I promise you they will explain all of this way better. Also, reach out to other parents of trans kids. First off, gender-affirming care is healthcare. It helps people live comfortably and authentically as the gender they know themselves to be. It can include social support, mental health care, and medical care when appropriate, all guided by doctors and based on each person's needs. For children, this is heavily monitored throughout the entire process. The entire care is individualized, meaning that because every person of any age is different, their care is going to be different as well, and this adjusts to what they need. But there are guidelines to each step. For children, these guidelines are extremely strict. In most places like the US, it is so strict that the number of kids who receive more than social care is extremely low. The data shows in the US about 0.1% of children with gender-related diagnosis receive the medication per year. Again, especially for children, this is all done under strict professional healthcare guidance. So let's break down gender-affirming care into their parts. Because contrary to misinformation, surgery is not even the majority of it. We will begin with the part of the first steps for children and one of the easiest and somewhat more important parts. Social support. For children, this is simply listening to them and seeking assistance from medical professionals to help with the rest. The biggest part of social support is pretty easy to understand. Supporting trans people and just listening. We know from decades of study that a supportive family and friend group makes a huge difference in the quality of life in someone who is trans. Just one person can reduce the rate of thoughts of ending it all by up to 40%. Also, this includes changing clothing styles, pronouns, presentation, names maybe, and referring to them how they prefer. For children, this is the most they get for a while and should be pretty easy. Using a nickname should not be hard, and dressing how they want should be a given anyhow. For any child who's not trans, this is one of the simplest ways to give them time to figure that out. But you should still seek out the next part. Therapeutic and psychological care. It is recommended for all trans people of all ages to seek and receive mental health services of all kinds. For children, this is required and has a strict guideline that should be followed. Therapy is one of the first steps. This process will include observation. For children, This will involve multiple professionals in specific fields. This part is very patient-led, but for children, it has guidances from the medical professionals with the inclusion of the parents. They will help navigate the various possibilities, being very careful not to push in any direction. The team will suggest exploration of gender identities, monitoring for other conditions, and more. The entire process is specifically designed to reduce the amount of false positives and reduce the chance of doing something that the patient will regret. And the data shows with patients who start as minors, this process has done really well at this. After lots of observation, different for each patient, depending on multiple factors, they can move on to the next part. Medical care. This is the part where people start getting worried due to misinformation. In fact, people seem to ignore or not even know that the previous steps exist for children. Part of this is only applicable to children after a certain stage of development and prior to another, and that's puberty blockers. They can be used to temporarily pause puberty, but that's not really accurate either. More accurately, it slows puberty. For trans kids, this gives them more time to work through everything and think. This also gives the previous step more time to make sure they sort of weed out those who are not trans or do not want or need more. And the consensus from major medical bodies is that these are safe and reversible. By definition, these actually prevent irreversible changes from occurring. Because by pausing puberty, we prevent trans boys from growing breasts or menstruating, and prevent trans girls from developing a deeper voice. All of which can cause a severe stress called gender dysphoria, and without treatment can lead to way worse outcomes, and requires surgeries later on. This gives even more time to decide before the introduction of cross-sex hormones. In the US, the youngest you can be to receive cross-sex hormones is 16, which is the age of consent in many states. And even then, it requires a parental consent prior to 18. With this and all the strict guidelines, only 0.1% of trans kids receive puberty blockers, let alone moving on to hormones prior to being an adult. Throughout every step, there is constant observation, supervision, and up until a certain age, parental consent. Prior to hormones, they will also discuss fertility if the patient wants children. They will make a plan that benefits them. They may freeze their eggs or sperm for later use or wait to transition further. Until cross-sex hormones are introduced, everything is reversible. We have now moved past where children can go without extreme circumstances. The next is surgical care. This is sometimes the last step for many. Other steps will continue as needed. Therapy is recommended lifelong, but it's actually recommended for everyone lifelong. The data shows the majority of these surgeries And all these surgery performed under 18 are chest related. For those under 18, 15 is the youngest. But this is where things get a little bit misleading. About 97% of those surgeries under 18 are done on cisgender boys and men. And some of the remaining 3-ish% are cis girls, making these surgeries almost never done on trans kids. So the fear-mongering is just that. It is unwarranted. Also, not everyone needs or wants these surgeries. Not all trans people want to change anything further. Some don't even want HRT. I will not go into further detail about these surgeries here, as it is not the point of this video. I may do a video on this much later, but I'm not sure yet. The key thing to remember is that these are almost never done on trans kids. Almost all are cis boys and many cis girls. Gender-affirming care is a whole group of treatments and procedures. Every part is designed to be age appropriate and with a purpose in mind. That purpose is to help trans people without hurting anyone who is not trans. For cis people, the strict guidelines help keep them from going further than they need. For trans people, these treatments are literally life-saving. It reduces the risks of thoughts of ending it all by 30 to 40% and reduces depression. The therapy and support alone increases their quality of life. These treatments have been developed over decades. They are not new, they are not experimental, and they are evidence-based. They literally save lives of children and adults. There are so many who would be around that would be around my age today if they had had this when we were growing up. But unfortunately, that was not available for them. Look, let's talk. Really talk. I understand many of you are still not convinced. I will leave the links to the sources below so you can look through them. I understand the fear, especially if you're a parent of a trans child, or if you think you might be trans yourself. I know there's concern that children will make bad choices and end up regretting it, or that somehow the misinformation is correct and all this will cause them way more harm. But these are people's lives, children's lives. Everything here affects their lives in so many ways. If we're truly concerned, shouldn't we want the actual experts to do their jobs? If you knew your child was suffering greatly and wanted to find out what could possibly help, would you want a team of experts or a politician helping you? Just look at the data from real sources, not ones designed to other groups of people. Look at what the medical consensus is. Read the data. And if you're still not sure, let the patients, the doctors, and parents do what is best. I promise you, they all know better than you at this point. I promise you, none of them are going through any of this lightly. Many parents would not go through this if it was not necessary. Hopefully, this video gives a little more insight into what gender-affirming care actually is and why it's needed. Uh, Please look at the sources I linked below and find more. I will also provide a link to a video by a biologist about biological sex. I will be providing more in other videos on other topics, but try putting yourself in these people's shoes. How would you feel knowing that science has provided a way to live better, fuller lives, and others demanded that right be taken away? Or if you were a parent who knew your child could be happier and healthier with care that has been proven time and time again, only to be told, nope, it's not legal. Try to learn more. Knowledge is never a bad thing. And if you still don't know, leave it to those who do. Gender-affirming care is not and should not be political. It is about people getting the care they need to live. I truly hope this helps. You all be well, and I will see you in another video.